This year, Health Data Management named her as one of the most powerful women in healthcare IT. Health 2.0 awarded her their prestigious 10-year industry leader. She's one of the most widely accomplished healthcare technology leaders today. Helen Figge personifies disruption, diversity, and the surging need for growth in female leadership in healthcare IT. She's speaking on a powerful movement, and it's happening right now on Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. Helen Figge is the Senior Vice President and Global Strategy Leader for LumiraDx. She's a certified Six Sigma Black Belt and Six Sigma Lean Sensei who served in 3 Fortune 500 companies and in the highest levels of HIMSS leadership. More than that, she's mission-based, serving on CHIME as well as state boards involving health and human rights, public health, pharmacy, Health 2.0, and WEDI. She's won numerous awards and is often quoted in major media. Welcome aboard, Helen. It's a pleasure to have you on Red Hot Healthcare.
Thank you. It's great and very cool to be on the program.
Well, let's jump right into it. I'm really excited about the show today, and I know our audience is going to get so much out of this. I read a quote from you recently in one of your interviews, and here's what you said. If we all continue to follow what has been laid out, chewed, digested, and regurgitated back to us, and not challenge the norm, then we will continue to be a society that manages chronic disease instead of wiping them out. So challenging the norm, it's something that you've always been about, and I'd like you to elaborate a bit more on that for our audience, please.
Well, in all fairness, I think there's a lot of opportunity for change. If people have talents and they have a vision and a passion of wanting to make a difference, I think that's where a lot of my excitement and my career really has taken me. And challenging the norm is very important in the sense that it keeps people thinking and moving forward, and it prevents stagnation.
Helen, I think that your story is tremendously inspirational. I'd like our audience to get an idea for where you've come from and what you've had to overcome in your own climb.
Well, I always tell people it doesn't matter how you start your life, it's how you live your life. I come from a family where my father was a prisoner of war. He was captured by the Nazis at the age of 12. And my grandfather was in the court of the last czar that, believe it or not, he came over in 1915 looking for a wife only to get caught in the Russian Revolution. And he stayed behind, lost all of his family and wealth, and worked the coal mines. My father and my grandfather spoke English, but did not read or write English very well. Actually, they barely were able to read it or write it. So as I grew up, my grandfather who lived with us became more and more ill with chronic diseases of emphysema and asthma because he worked in the coal mines. I remember going to the drugstore with him at the time, the local drugstore, and having to, read the prescriptions and also pay for the money through in his wallet because he was getting blind. And I learned at a very early age to serve people who were of need of your services. But it came close to home because I realized just how important health was, but how important the communication of it. And that really transpired how I live my life daily. Whether I work in any environment, I always try to see what could be changed for the betterment of the all. And I grew up in that environment where, again, education, regardless what you were learning, but learn something you don't know. And I remember my grandfather or my father or my mother saying, gee, do you know how to do this? Well, if you don't, sit here and watch me so you know how to do it next time. I took that same principle and moved it through my whole career. So I picked up talents that I watched someone who did it very well do. And I think that is what inspired me, but also has set me apart with many skills that I've acquired simply paying attention to someone who did something well.
Yeah, this is interesting. One of the things you told me that really captured my attention, Helen, off air, you're a first-generation high school graduate, and you actually flunked kindergarten.
Yes, I actually flunked kindergarten, which is probably unheard of. I remember coming home, and I had all N's, which meant, not satisfactory. I had to stay back. I was the only one. And at that time, I lived in a rural environment, and we were Eastern European, and most of the people in my neighborhood were Italian. And I remember, having the ability to sit there and just be sad. So I went home with the report card, and I'll never forget. And I said to my mom, I said, I flunked. And she said, really? Are you sure? She took off her apron. She crossed over the hill onto the road. She went into the kindergarten room. And an hour and a half later, she came back and said, Helen, guess what? You passed. I have no idea what she did to the teacher, but nonetheless, my mother was actually my savior of life. And I think mothers and women who have the nurturing ability, I attribute my success to those type of kindnesses because I was very challenged. I had dyslexia and I was very tall. I was 5'9" by the age of 12. I always had to be in the back of the room. Why I'm telling you this is everybody has an obstacle to overcome. Mine oftentimes was physical, and it took me maybe 3 or 4 times to read a paragraph to understand what it was. And at that time, no one knew what dyslexia was. So not only was I a little slow, I stood out, and they always put me in the back of the room because I was one of the tallest kids. So between that and my home environment of seeing my father and my grandfather struggle, not being able to read, but embarrassed to tell anyone they couldn't, really set me in my career of yearning to learn, yearning to find talents that I wanted to absorb to be a better person. And I think that's where my career has led me to this point.
Yes, you've had a stellar career, a lot of accomplishments as a woman. And where this is going to lead into is that women are vastly underrepresented in healthcare IT and really in healthcare leadership roles. I want to give the audience some statistics that are really eye-opening. 78% of the healthcare workforce is comprised of women, but only 21% of all executives are women. 11% of all healthcare CIOs and CTOs are women. Of the 125 women in healthcare that carry an executive title, only 5 serve in operating roles as president or COO. And there is only one woman CEO of a Fortune 500 healthcare company today. And Helen, I'd like to reach to you on this. Why do you feel that this is so disproportionate?
In all fairness, healthcare is a very changing environment. Oftentimes, women went into nursing and those type of jobs that they weren't as creative, but more delivery oriented. And I think healthcare and medicine and IT continuously evolves and changes. And I think women haven't had the opportunity in the past to be able to be in an environment where there's fast change, fast pace, need to pick up the skills. So they get to a point where, okay, now I want to really engage in this, environment. I firmly believe no one wakes up and says, nope, I'm not gonna hire a man for this job. I'm gonna hire a woman because I can pay her cheaper. It really comes down to, can you do the job? Do you have the necessary skills? I'd like to see an environment where people just send the resume, don't tell you if they're a man or a woman, don't put their last name or the first name to show any ethnicity or anything, and just tell us what your skills are, tell us what you've accomplished, tell us what you can do. And I think we get to a gender neutral environment. But women have been in an unfortunate position where, for whatever reason, and this is my personal experience, perhaps they didn't have the exact skills that were needed to execute efficiently the task at hand. And I think that's changing. I don't want to see women saying, poor me, hire me because I'm a woman. I want women to be hired because they've been there, done that, and can execute the job and do it like no one else.
Right. So that's a good point. So you don't believe that women should be given jobs, and especially leadership roles, just because they're women, right?
Absolutely, because that sets you up for failure. Number one, you want a position and you want a role where A, you can grow as a person, B, you can make a difference in the lives you touch, and C, you can have accomplishments. If you give a woman, a job that they're not fit to execute, you set them up for failure. And that's the one thing we don't want, to give a person a position and then they feel incompetent or they feel insecure. We want them to flourish, then have some downstream successes and downstream protege that will follow in their footsteps. That's where we need to go. Healthcare IT is a fast-paced, changing environment. And you got to keep on your toes and you have to learn. And then you have to adapt. And then you have to redirect.
And now, a few words from your host. I get email from listeners that want to know what I do. Hey, I'm a consultant working in two areas. First, multi-level consumer engagement. I provide tactics and strategies to direct engagers, such as hospitals, payers, life science, and medical technology companies, and to indirect engagers, companies that sell products, software, and services to the direct engagers. If you haven't created tactics, strategy, and partnering around engagement, don't be surprised when consumers continue to close you off. Second, I'm a heavily connected networker who strives to connect pieces that drive innovation, collaboration, and mutual benefit. Every relationship I carry across multiple healthcare industries is open for contact, conversation, and business. Everything's changing in today's healthcare, and in many ways it's become an unsettling and yet opportunistic Wild West. Reach out to me if your company would like new thought, tactics, and strategy to increase growth and profitability. And now, we're ready for the show. One of the things that you brought up, and just in answering that last point, which I like, the gender needs are really put behind the business needs. And just to that point, I know we spoke off air about this, Helen, that the global consulting firm Mercer, they just released a 2016 report on the state of women in the workplace all around the world. And the report states that women are 118 years away from closing the gender gap completely. Educated women who are not in the workforce right now represent a potential GDP increase of about $12 trillion. I mean, that's just mind-boggling.
It is. It's absolutely mind-boggling. And I think there is definite opportunity there. You know, I harp on education. I harp on learning, because in the end, even if you don't use those skills that you've learned or have, and I don't mean didactic education, I mean real world, been there, done that, accomplished this. Those skills you can never take away from anyone, but they build upon more skills. And I think if women realize that and really pay attention to it, you know, we hear a lot about the STEM programs, women in, you know, the sciences and engineering and math, and how to get, you know, young girls and young women motivated. I say, get them excited. I don't know how many times I sat in organic chemistry class and doodled on a piece of paper because I saw, you know, a less than attractive person, you know, babbling some type of formula, and I just didn't get it, and didn't get it explained to me of how it was so necessary for life's paths of careers. And I think between the educational components and the inspirational components and fitting this into everyday life, but I think everyone, man, woman, needs a career, because careers, we live oftentimes most of our days in them, and we want them productive, but we want them meaningful.
You know, one of the things that I'm taking from this is that there's been a lot of blame to go around that the reason women are not up in leadership positions is because, and some people would say solely because the pushback of the good old boy club, the male leadership. But one of the things I'm hearing you say too, and that I believe, is there really is a responsibility on the part of women to gain greater confidence in not only their efforts, but really to recognize that they need to take more risk, and that even though that might lead to failure in some cases, that the resiliency and the ability to reach out and sort of go for it is going to be, as we move forward, more welcome with better results.
Absolutely. And I can tell you, I've worked for 3 Fortune companies. I've been in academics. I've been in nonprofit organizations. I've never, ever heard a conversation where a man said something about a woman's skills or lack thereof, or they wouldn't want to hire somebody because they were a woman. I think women have to have the confidence within themselves, but also in the environment they want to work in, to understand A, the landscape, B, what needs to be done, understand the conversations that need to take place, and then all of that married together to create a persona that people want to work with and follow. And I think that's very important. You got to want to work with the person and follow what the person is saying as a leader, inspirationally, make a movement. And I always say this, if you have a passion, it comes out in your work, it comes out in your conversations, and it comes out in the long run to even a better place of where you are now, because people recognize when you want to really do good. Yeah. And I think women have to start thinking that way, because, you know, the more I want to use the word pity women, saying, you know, poor me, I'm not making enough money, I'm not in the career I want. Okay, stop, think, strategize, and figure out your end game.
What is it about women in particular? We want to get more gender neutral, certainly, and have leaders in all industry based on their qualifications, their skill sets, and the value they can bring to companies. But I mean, there are differences between men and women. What have you found that women bring to the leadership positions that differentiate them and make them valuable to companies?
I'm a great example of that, and I'll tell you why. I always took jobs or always offered jobs that oftentimes people did not want, or failed at. And they would say, okay, well, give it to Helen. Maybe she could do something with it. And I think, subconsciously, maybe they say, okay, give it to her because, we don't expect much from her. Well, ironically, I proved them all wrong. So, for instance, if I had to go to, when I was, going to college, I had 2 jobs in Boston. I went to the Mass College of Pharmacy and I worked at Children's Hospital and the Farber. And, I tried to really spread myself out. And I took jobs that were at oddities because no one wanted them. But I think women are willing to accept jobs slightly below their expected personal expectation for the sake of maybe supporting themselves or other issues important to them, maybe family and, another work environment. So being able to attract and train and motivate and even promote women to these roles really, in all honesty and in sense, creates a loyalty factor to an employer that in turn can minimize even company turnover. So if I was a hiring manager and perhaps there was a woman who was looking for employment, you're not going to come out of the gate being a senior vice president. You may have to be a manager and work your way up. But what a great way to start a career and create a loyalty factor with your employer and gain skills that then you can use moving up. Yes. And that's how, that's what happened to me. I just literally had a job, did something really well, was commended for it. And I'm like, oh, cool, that's great. And then someone may have worked with me or saw my work and said, hey, I saw your work. Would you be interested in working here? And that's literally how my career was created.
Yeah, it's like what you're doing is you're first really focused on being the best you can be and bringing the value to where you're employed at. And then other people will just be attracted to that. They just come to you. You don't have to force yourself on them.
The best revenge is your own success. And I tell that to people who, all of us have had career obstacles and career pitfalls, and we've been down in the sewer and we've climbed ourselves back up. No one's had a perfect career path, but your best revenge is your own personal success. And I say that to people anywhere, anytime where maybe there's a quandary in their career.
Yes. And I want to switch gears and move into another topic because you are one of the strongest and most well-known healthcare IT leaders today, man or woman. And I'd like to talk to you about where you see the efforts moving in healthcare with respect to putting more emphasis on the healthcare consumer.
Well, it's interesting because we're living longer and we're getting ill sooner. And what I mean by that is there's pandemics of pre-diabetes now in our youth. And we're living longer, but with chronic diseases. So we're seeing this whole timeline of, by the age of 80, people are still alive, thankfully, and living with chronic diseases. So I think healthcare is really got to meet these needs for the future. We've got to eradicate a lot of these pre-diagnosed illnesses like prediabetes. There's going to be a more active push with mobile devices in use. Individuals will be rewarded for staying healthy and living longer, healthier lives with more productivity. I want to reward those people who are waking up 5 a.m, speaking for myself, going to a jog and then having to come back and go to work. I think we got to start rewarding that. And regardless of geography, clinicians need to take the front row. So I want to see women who have stage 3 breast cancer have the same opportunity for survival if they were going to Sloan Kettering versus if they were going to, in a rural Idaho town.
Yeah.
We've got to really streamline it so healthcare is attainable for us all. And those that are really embracing their health be rewarded, and those that may not value health as much as others be educated and be reinforced to say, you could be doing this if you did that. And I think mobile device technology is really going to play a pivotal role as we move forward in time to help connect people regardless of where you are in the world.
Yeah, great segue into my next question here. And one of the things that I have read that you said as well was, and I'm quoting here, introducing the right technology in the right circumstance and at the right time really makes a difference in a person's healthcare experience when delivering and receiving care. So I'd like to talk to you about patient engagement and where you see efforts needing to be in getting patients on board with that mission.
Well, I always tell people, you've got to figure out what makes a person want to care. We have tons of technology out there, so much technology measuring so many pieces of data. But at the end of the day, are we any healthier? After a while, people, turn off their reminder. Oh, you shouldn't eat that piece of cake. Well, I'm just going to shut this off and I'm going to ignore this. The opportunity to really motivate is really going to be the change agent for patient engagement, because the technologies, we don't need any more. We don't need any more apps. I'm sorry to tell all those app developers out there, but no one has gotten to the point of saying, how can I make a person care to take care of their health? And particularly when you have prediabetes or certain forms of other diseases that are chronic and terminal, if you don't take care of it, they're asymptomatic. So by time the symptoms occur, for instance, in diabetes, oftentimes it may be too late. We need to have early intervention and consistency.
I had a career for many, many years as a chiropractor, and we have always looked at asymptomatic people knowing that just because you don't have any symptoms, you don't feel any pain, or you don't notice any changes, doesn't mean that change in disease isn't teeing up and happening. For the diabetic, for the person who has osteoarthritis, they may have 20 years of joint breakdown before they feel their first ache. Then by the time they go and get an X-ray or an MRI, they've got to have a knee replacement. And they should have known about that 20 years ago.
And the other thing is, think about it. If you have a chronic disease, do you really want to talk about it every day? Do you really want to measure it every day? I mean, just think about it. And I always tell clinicians, sometimes people just need a break. So we don't want to be able to have to talk about this for the next 30 years of our life, say. And I think people aren't getting that either in patient engagement. I call it patient empowerment, but there's got to be a balance. Yes, we want you to take care of yourself, because if you don't, we're paying for you not taking care of yourself.
That's right.
And that's a concern for me. But at the same time, I wouldn't want to be reminded that I have diabetes and it's terminal, and meaning like there's no cure for it right now, particularly like if I have type 1 or something like that. I don't want to talk about it. I just want to live my life. So if you can have a technology and a mobile app and some intervention that doesn't make me constantly remind myself about this, I think that will be the nirvana in patient engagement. And we are not there yet, because if we were, people wouldn't keep developing all these apps to remind us, take our blood pressure, take our temperature, go to sleep, wake up. How many hours did you sleep? It's overload.
Helen, as we close up here, any final advice to women out there?
As a mother of 2 daughters, I really want women to think and empower themselves. I think gender should not define any career accomplishment. My best career advice is to seek out people who do things well that you want to learn. They don't need a big title. They don't need a big job, but if they have a skill that you want to learn, that empowers you, because skills add to other skills that add to your storyboard of who you are as a person and what sets you apart for a position and a career path. In my career, I sought out those that I admired and wanted to learn from, and that really changed my trajectory of all of the abilities that I had and have in my career. And now many of those people, regardless of the titles then and now, have become great friends and colleagues. And I'm proud to be able to really consider them that. I always tell people as well, regardless of gender, you're going to meet people climbing up the ladder as you do climbing down. And you want to be able to look them in the eye both ways on that ladder. And if you can't look a person in the eye, fix it. Because the world is very small. And with 6 degrees of separation, as the formula goes in careers, you need to respect others. And I think career-wise, respect goes a long way to building a career, particularly for women and men. But women have the edge because I really believe we're nurturers and we have an emotionally based environment enough to bring that forward. And that's an empowerment as well.
Powerful, motivating, and meaningful words from Helen Figge. Helen, thank you so much for coming on today with Red Hot Healthcare, and it was our privilege and pleasure to have you. So thank you once again.
Well, thank you, and I look forward to some great, exciting interviews that you'll be doing as well, Steve. I think this is a very exciting program, and I just am fully in support of it. Thank you for inviting me.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.